Implementing a pain management program in a veterinary practice takes some thought, but it is very straightforward. The American Animal Hospital Association has developed a recommended pain management protocol for accredited practices and is willing to make those guidelines available to interested parties. There are two very broad categories of pain, acute and chronic. The majority of acute pain patients in a veterinary practice are those experiencing either a surgical or dental procedure, or those who have been the victims of some kind of trauma, example, hit by a car, fractured limb, etc. The trauma patient must be assessed, the source of pain identified, and then the underlying problem must be treated. Very often, once the traumatic issue is identified and treated, including the source of the pain, the animal can begin the healing process. For the surgery dentistry patient, the veterinary healthcare team has the opportunity to plan the procedure and then prevent the pain experience through preemptive analgesic techniques. Preemptive analgesia involves anticipating the pain experience and putting into place appropriate medications to prevent the animal from experiencing pain. Let's examine a specific example. A dog with a foreign body in the intestinal tract that must be removed with an enterotomy. The dog receives premedication with an opioid and acepromazine. The opioid not only relaxes the patient, but acts at mu receptors in the central nervous system to block pain signals from reaching the brain. Following anesthetic induction, the dog then receives additional pain medication by constant rate infusion, CRI. CRI means delivering very small doses of pain medications continuously via an IV infusion pump. Typically, CRI drugs are chosen to have effects at multiple locations in the central nervous system. In this case, the veterinarian might choose fentanyl CRI and ketamine CRI. The fentanyl blocks the mu receptors in the central nervous system, while the ketamine blocks the NMDA receptors in the dorsal horn of the spinal cord. This combination prevents pain signals from ascending the spinal cord to the central pain perception areas in the brain. This combination of CRI drugs also decreases the need for inhalant anesthesia, allowing the veterinary nurse anesthetist to lower the setting on the vaporizer. Once the procedure is over, the patient can continue on the CRI drugs at lower doses than during the procedure in order to achieve ongoing pain management. Following a bowel surgery, many veterinarians choose to deliver the NSAID pain reliever a day or two after the procedure, once the patient is eating, in order to allow the GI system to begin the healing process first. The patient may then go home with several days of follow-up pain medication, such as an NSAID, with or without additional medications such as tramadol, a synthetic opiate. Many of the older animal patients who enter the veterinary hospital are experiencing chronic pain of one type or another. The most common source of chronic pain is osteoarthritis. Unfortunately, a large number of pets who suffer from the pain and discomfort of osteoarthritis are not identified as pain patients and consequently do not receive the treatment they need and deserve. This is especially true for cats, who are notorious for hiding their symptoms when they have problems. In the next section of this program on pain management, we will take a closer look at chronic pain and explore strategies for identifying and responding to animals who suffer from it.